Hi, everyone. Welcome back to Misconceptions. So glad that you're here. We have an exciting opportunity to spend the next 40 minutes or so, maybe a little more, a little less, with Chanie Delman. Welcome, Chanie.
Hi, thank you. Thanks for having me.
Absolutely. So we're having a conversation today. We decided to call this a therapist edition. And as people who've been listening to the podcast know, we have our regular episodes and that are kind of for the broader community and audience. And then I have created a few specific episodes that are more directed to the therapist. And my thinking on that is you can go to a training and then you come away with like, okay, but what about this scenario or that scenario? Or like, how did I just compact all of this information down? How do I like kind of drill it down to take home messages? And I feel like perhaps for the broader community, but especially for therapists, if you would like to learn a little bit more in depth about any of the topics we're talking about, this is the opportunity to put out good education, good content. And so I turn to you to have a conversation around infertility. This is one of those areas that, for those of us that work in the reproductive mental health space, understand you really need to have additional training. And I just have to put that out there first and foremost that just because someone experienced infertility of any kind does not mean that you now become an expert in working with people with infertility. And I think it's one of the biggest mistakes, and it's a disservice, right, to the community of like, this makes me an expert enough. And there really is some foundational education and training around reproductive mental health. I'll put a shout out there for American Society of Reproductive Medicine. They have 18 hours of training for therapists that if you want to consider yourself an expert or doing this work, make sure you begin with working with that 18 hours of you kind of like pay as you go of several different modules on infertility. So,
And I
Connie,
think, Dvora, I'll just tell you, I'm that example because when we met, I want to say 12, about 12 years ago, you were like, Connie, hi, go get trained in all of these modalities. I wasn't in the reproductive and maternal mental health field at that time. I was doing couples, addictions, teenagers, and we met. And you have guided me in that area. So I have tremendous gratitude for that in getting all these trainings because, yeah, how could I do this work if I didn't throw myself in depth to really understanding all of these different areas?
absolutely. And I think that the reason I think infertility in particular is so important is there's a tremendous amount of medical associated with fertility. And you don't have to become a doctor, you don't have to become a reproductive endocrinologist, but you better be knowledgeable about the procedures and all the thousands of acronyms that people use when dealing with infertility. So, Chanie, this is a conversation that you and I are going to have. We're going to have a good time. We're going to talk about working with the individual and then the couple when there is a challenge of fertility. So let's start with, first of all, tell me a little bit about yourself, because I think it's best to do a quick introduction. Tell us about yourself.
Okay, so I'm a licensed clinical social worker in the field for 25 years now, and really in reproductive and maternal mental health the last 12 years, almost exclusively now, seeing couples, individuals with infertility, infancy and miscarriage, loss, a lot of grief and loss work, and postpartum um, as well, postpartum depression, anxiety, and under that realm. And usually, sometimes it's the individual that comes in, and then the couple comes in. Sometimes it's the couple, sometimes it's the individual. And I have a private practice in Queens and Long Island, and virtual, like all of us.
Mhm.
And really enjoy this area very much. So I'm excited to dive right into the conversation.
Okay, so let's start with the individual. I'd like to start off with the woman. And I think whenever we're starting off the woman because it seems the most obvious, but I think to set the stage, I think we want to acknowledge that 50% of infertility is male factor. And right, we used to call it a third, a third, and a third female, a third male, a third. We don't know why. And now really the kind of the data is saying 50% male, 50% female. And yet, who are our primary patients is always the woman.
It's all,
Okay. Always the woman.
yeah.
And even when there is male factor, she's still going to be, for the most part, the identified patient. Um, tell me a little bit from your experience. What do you think about when this woman walks into your room and she says, my husband and I have infertility? And for the purpose of this conversation, our conversation is going to center around heterosexual couples, typically that are married. For the purpose of today's discussion, let's set that as the stage. What are you thinking about? She walks in the room.
So it's interesting to see when they walk in the room. And I was kind of thinking of going into our discussion, is it always the same? And it's really not. It runs from really almost within a year, after marriage, like yikes, 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 I'm not pregnant, to, secondary infertility, to actually going through their infertility journey and then feeling so overwhelmed, and someone says to them, maybe you want to go get more support. So they're coming in, and then sometimes the couple actually comes in together. We're going through this, we need more support in our marriage. We need more support in the guidance of it. So it's interesting to see where they come in. And depending on where they come in, they have to use like a little bit of a different model of, the acceptance, coming to terms with what they're coming, the anger they're coming in. The most I see is such raw emotion, right? So if I'm their first therapist coming in at them, it's just like raw, immense sadness, immense difficulty, overwhelmed, a lot of loneliness, isolation, misunderstanding in the emotional realm, and sometimes just in the medical realm. What am I doing? Decision making. So it's a lot when they first come in. They're really holding on to a lot. And sometimes they've been holding on to a lot for a long time, right?
Right.
It's not necessarily everyone's going to therapy for infertility. It's not the first thing. They're usually navigating a system, and then are hit with this is more than we expected, a lot thought would happen.
I think about that as an interesting perspective also in saying like, you're right, because if there's, let's say, an event where, somebody loses a child, or there's a miscarriage or a stillbirth, there definitely already is a discussion around like, maybe you want to get to sit with a therapist and do some grief work. But when people go into fertility, difficulty or treatment, it almost is like it begins to just unfold one foot in front of the next without anybody saying, hey, 1 second, this is going to be hard. And I think part of that maybe is the expectation of like, well, I'll just get pregnant next month, or it'll just take 2 or 3 months. And then like, we'll figure it out. We'll take some pills and I'm going to be pregnant, maybe some shots, and I'll make a pretty picture with all the shots that I didn't have to use. Right. Like there's lots of things that I think young individuals or people that are just starting out on the journey are so focused on like the practicals of it, that when it comes to the emotional part, maybe it's actually ignored. Like it really isn't something that's brought up.
Yeah. And I think we're seeing it like from the referrals is a lot of times from the organizations that have been talking to this couple, navigating with the couple, and then they're starting to hear, wow, this is a lot. It's like many of my referrals are from those organizations that are already supporting them in the medical. Oh, this is more than, or they're hearing in their voice, this is just too much for me, or too much for us.
Right. It's an interesting point, because what I'm also hearing from those referrals is like sometimes it gets to be too much way before they actually refer, which is an interesting conflict where, we have amazing supportive organizations, but that sometimes hold on to people that probably need some therapeutic support a little bit sooner, which, it's just a process of getting very invested and engaged with couples who are going through hard things. Maybe not quite 100% knowing where the line is between supporting and referring when it comes to psychiatric or psychological support. The thing I think about too is how often these couples are incredibly young, right? Like you said, like they're starting out frequently they're barely married a year. And somebody who might not be familiar with the religious world might be like, wait, why would you go for treatment when you're only married 9 months, right? But there's a strong reality of wanting to get pregnant or intending to get pregnant within that first year.
And that I think is just, we know that piece so well, but it comes out, so the pain really comes out, when they're sharing that. And we've heard this before, but I just like want to reiterate, giving, to the therapist, just giving so much space to our communities that everywhere you turn, there's a carriage, there's a parking lot of carriages, there's the courtyard of carriages, there's the baby, right? It's just the baby bump, right? And it's just within months, really within months of marriage, no one feels like someone's not looking at their stomach,
Right.
right? So the pressure of couples when they haven't gotten pregnant pretty quickly, they are coming in younger. They're starting younger with organizations, with testing, with, hey, what's going on? Even before all that, just with the disappointment,
Absolutely.
just with that period that comes every month. Wait, what? Isn't this how it's supposed to go? So it's just so early on and so sometimes so young, 19, 20, 21 year olds are already met with this, which is a challenge. It's really a challenge.
Yeah. I think also this idea of like the exposure to communal norms, right? So somebody might say, but that's ridiculous. You're 20, 21, 22. But if the community norm is one of you get married, you have babies, whether you desire them or not, and I would say most of them are desired to some degree, but the community norm is one of we will get married and we will have babies. And then when that goes against when for whatever reason your body is going against the norm, it feels scary. It feels very scary.
Yeah,
I think just looking at statistics, we know at least 80% of couples will get pregnant within the first year while trying actively to get pregnant.
yeah,
So, that's a pretty significant number. But I think for our couples, some of the young ones especially are panicking by month 6, 7th, and 8th,
yeah.
and often turning towards their parents and saying like, "Help, what do I do now? We're not pregnant."
Right.
What are you noticing about the intergenerational relationships when we're dealing with these young couples?
So it's interesting. Like, I think, I do work a lot with the Hasidic community, and it's very, everything's your mother, right? Shana Rishona, first year of marriage, you're at your mother's every night for dinner. So then why also would this not be part of it? What's going on? How's it going? Right? And that worrisome. I've actually had a few mothers, just the mothers reach out to me for their daughter, right? So you would
Right.
think, oh, I want to call and reach out to a therapist. No, some in the Hasidic world, many mothers will call me and say, my daughter's going through this. Can you see her? Right? And be already involved in the medical, be making phone calls for them. And I think that's a hard piece in a young couple in all areas, not just Hasidic, that like how much are we navigating together? How much is our family involved? How much are we sharing with our families? And I see that as a common theme also. How much should we and should we not share? It's kind of like in general in the infertility. And I feel like there's always this question they're asking me, like how much? And it's a really like so much of the work, especially in infertility, really like what you feel you're comfortable with. There are no rules here. And sometimes you share too much and then you're like, whoa, I want to take it back, right? And some people are, nope, no details, no nothing. They just know we're going through something. And it's interesting, and it's important for us as therapists to explore what feels good for them and not go on, well, I should, or I want to, or my husband doesn't want to really navigate together individually, but really this is a couple's issue. How do we want to, what's comfortable for us, for our families to know, and being okay with that. It's okay to just share we're going through something, respect this, and it's okay to reach out to them, for many are financially, that's a big part of it. Many of them are still on their parents' insurance. So even if they're not sharing, someone's seeing that bill, right? So
That's true.
yeah,
Hmm.
yeah.
Yeah.
So many times it's like, okay, like we have to because we need their help. We don't want to. And so I think that's a big discussion on an individual, but very much on a couples level that we have to give our clients really that space to explore what they feel comfortable with.
But I still think when I want to divide that down a little bit because I think that when I think about that, I think that especially with young couples, they may not know what the options are, right? Like, is it an all or nothing? Do I have to share all this information? Do I have even just saying I'm going through a hard time? I think about how many parents would be accepting of that reality of being like, okay, no, that doesn't tell me anything. You got to tell me what's really going on. I'm here to help. I'm your mother. This is what we do versus the autonomy that we're assuming perhaps some couples actually have. How are you? What are you seeing? What are you seeing? How do you see that present?
Yeah. And so I also have to check myself because
Right.
my bias is more like an individual, they're a couple, they need to do this together. And so it's really first on us as therapists to explore really what their relationship is and stay with that. I think that's such a critical piece because some of them are just very reliant. I had a couple that was a woman that I was working with. Her husband hardly knew a thing because she was just working with her mother on it. So that I thought was a little bit, and culturally was somewhat, oh, we don't want to upset him. We don't want, he's not really understanding everything. And so I had to navigate slowly and educating her that you're a couple together and doing this together as a couple, educating him, not to disclude her parents, but to do this more, as a unit. So it's interesting to see, and again, I have to kind of just stay with where they're at and what they're most comfortable with, but ultimately is really critical for that couple to have some autonomy. And again, they don't always know everything that's happening that's coming down the line. So I feel depending on when they come in the room, we're doing a lot of just education, a lot of
Right.
education.
Right. I think about that the likelihood is that the older the couple, the greater likelihood that there would be hopefully some development of a relationship between husband and wife, and that they're more collaborative, and that more of those challenges that you're describing are with younger couples
Yeah.
specifically, correct? Yeah.
Yeah.
When you're dealing with, how often do you see men, just the husband?
Not very often. It's more in the context. So the couple come in together, and then if he feels he needs, or I'll, offer some individual sessions with him. It's usually, it's usually the wife coming in, dragging him in. Usually in my work, sometimes they're coming in like really on board together. And I find interesting, so if the husband didn't want to come in, he may be just like not into therapy, not into getting the support, also just having a hard time with the infertility, obviously, and doesn't really want to be pushed so much. So I just kind of gauge that. I don't want it to be like any therapeutic relationship to backfire. And so I actually will give him like a pass a little bit and encourage her also, like, be here, you don't have to, just do some work with her while he's sitting there so that he doesn't feel it's on him. And what usually happens in most of those cases, she'll continue to come, but she'll just do great work that he'll kind of come alongside. I'll usually
Mm,
encourage her, like, just let's wait and see. If you're doing this work on your own, you're going to see the influence you could potentially have. Not always. Sometimes, I'll offer him his own sessions. I'll offer him his own therapist if he's not comfortable in the setting. But majority of the time when she's doing, I just had a client text me a picture of her husband with a new baby relative, someone else's, that they had really a lot of trouble, just like, I can't believe this relative's having a baby. And she's like, look how far we've come. And it
wow.
was really a lot of her great work. She did just
Right.
a lot of good work on, in our office and on her own. And that kind of he saw and came alongside.
Can I say something when you say she did good work, what do you see as the work? What
Right.
is the work?
Right. Such a good question. Okay. This is gonna sound, it's so brief, but it's like over time. So heads up. You know, the work looks like I use the word like moving the needle. We're just like moving things little by little. So when I use the word acceptance, it's like, what? That's like such a big drastic jump. Like, oh no, 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 no. But in moving the needle, can I come to being okay with not being okay, being okay with my infertility journey? Um, a lot of times people come in very angry. So a lot of the work will be putting down the anger, right? And putting down the anger and coming to more of the mourning, the sadness, the loneliness, right? We always say anger just covers up all those harder emotions. So that would be some of the work. Relationships is a big part of the work, that they were upset at someone in their family. They're upset at people not understanding them. So the work might be, not everyone's going to be perfect, right? Not everyone in my family is going to know what to say. Not all my friends will know what to say. Everyone will say something stupid. And even this piece of, and this is a powerful piece, when really these people in your life who love you really want what you want. You really want it also. You just don't really know exactly, even with all our training and all the support for the mothers and for the families and education we're doing, not everyone knows. And so those are pieces, those are pieces of the work. I think also just from the from the medical perspective, gaining knowledge, insight, understanding, preparing themselves. I think knowledge is a lot of power for many of us. Some clients know, just tell me what to do next. When am I going next? But many of my clients want to know and understand. And the more they know and understand, they really feel better about their journey. There's more in a place of total lack of control, more control.
Yeah. I think as well, the idea of, I think we can't underestimate the power of support, of coming to some place. I describe it as like letting out the balloon. Like the balloon is so full of hot air, so full of intensity, emotion, sadness. I'm not able to make it better. I cannot make infertility go away. I have not found that magic ball just yet, right? But I definitely feel that when people come into therapy, it's a place where they can exhale, that they can let the balloon deflate, and that balloon will be refilled the next week in therapy,
And
before therapy. But ultimately, when you come back the following week, we have the opportunity to do it again, to release, to refill in a good way. I think especially because
I love that because it's really what happens when they walk into the office. It's like, whoa, 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 whoa. And by the end of session, I didn't do anything magical, but that support and that release, you can see them walking out a little lighter.
exactly.
You could see it.
Yeah, absolutely. And I think that when we offer value to that, like, yeah, the value is just being here. And if you don't feel any different, then go find somebody else, because then clearly I'm not offering you what you need. But what we see is people feel like it's the one place they could talk about it. It's especially because infertility is such a private matter. And it's something that even people who are confident about talking about it learn very quickly that others may not be comfortable in listening, that others don't necessarily know how to say the right thing, that they may get a lot of like, okay, but God willing, in the future, Message Shem is going to be fine. You're going to have a baby. Don't feel so, instead of being heard and listened to and kindly supported. And so they learn very fast not to share. And so walking into somebody's office who's trained, there's a better likelihood of them feeling safe enough to let it all out here. And I think the term you've heard me use before is the idea of like, I'll carry it with you for a while, right? Let me carry that with you. I think that really speaks to the value and the benefit beyond all modalities. It's really, the work is about creating relationship and connection so that our clients feel safe enough to explore all of the stuff, and for us to just be there, watch them, bear witness, and do it with them in our own way. Yeah.
And it's a privilege. Like they're really sharing something that they can't anywhere else. Like they
Yeah.
want to talk it with other people maybe, but that feeling of no one gets it, no one understands it.
Why do
Um,
you think that is? Why do you think people have such a hard time being supportive? Like, why is this one of those sticky, sticky spaces? I mean, I see it with pregnancy loss as well. I think it's a little bit different maybe with child loss, when somebody understands like the grief of the loss of a family member. But even that, you'll hear from bereaved parents that has some time, it has like an expiration date on it. I'm wondering why you feel infertility is one of those spaces.
that a person who has infertility has a hard time
Feels, yeah, like feeling like they have a hard time finding support. Like, I
feeling,
want to talk about it, but nobody gets it. Like, why is it so hard for the world
right?
to show support for someone with infertility?
I think some of it has to do with that feeling, and obviously so many come into our office that there's something wrong with me. There's a lot of shame in it, even though it's a medical diagnosis, right? No one chose the infertility. No one like, I'm having a bad day, I'm choosing this. Like, no, it's not at all like that. It's not like, I'm gonna choose if I'm gonna snap at my kids or not. Like, no, it's a medical diagnosis. And and I think there's so many women, and we hear this in our office, and it always hits me, even though I know everyone has it. Like, I'm broken, something is wrong with me. Maybe my husband should have married someone else. I feel bad for him, right? It's like maybe I'm defective. right? And so I think because of that underlying deep emotion, then no one else can possibly understand this, right? And then there's just like very concretely, if you have a child, you can't get it. You just can't. It's so like, right? It's so out there,
Yeah.
like you can't really understand
Do you
them.
believe that? Do you believe that? Do you believe that? Because this is one of those common questions that therapists will ask me. If I didn't experience infertility, if I didn't experience pregnancy loss, can I still be a therapist for somebody and specialize in this area? It's the same question we get if you have never been a mother. Am I able to work in perinatal mood disorders? Like, is that something that's a required prerequisite? What's your perspective on that?
I don't think so at all. I think that runs for all of our, expertise. I think the ability, like you said, to carry, to hold space is just what someone's looking for. They need, you know, to be understood, and I think this is where it gets a little tricky. And there's been times in my office, like, wait, did I just say the right thing? And there's not always the right answer. For some person, they I want that person to call me. They better call me. And for the other, like, they better not talk about this. I don't want to acknowledge it. And so it's a tricky space of not really always knowing what this person needs. And I think for us as therapists, just being able to listen, if I hope that if I'm an empathetic person, and I hope I am because I'm a therapist, that I really can hold space for most things, even if I have not experienced or know what they're feeling, right? I can tap into, right? We know what empathy is. Can I just imagine what this pain that they're going through is? And so not on a technical, maybe, but being there for them. And I think that's, the art of it, of our work.
Yeah, I agree completely. I do agree. And I think that again, I think that when what I feel like sometimes happens where therapists go wrong in these spaces is where they feel like this obligation to say the right thing. And very often, like you just said, there really isn't the right thing at all to say. It's actually sometimes saying very little. So this pressure to say the right thing, and also the pressure to feel like they're sounding smart, like that they're sounding like the expert. And I think what's much more valuable is really turning right back to the original tenets of therapy, is creating relationship and being an empathic, compassionate person, is so much more important than the right thing and the smart thing that you may or may not say to that person. Um,
And I
yeah,
think sometimes when I'm unsure, I'll kind of like ask permission. I'll
yeah,
just be like, permission to go into this area, or permission to like talk about this. Maybe it's outside my realm. That may be in like, God related issues, and put something out there. And then say, what does that feel like for you? What does that sound like? I think
right.
it's so critical for me to always keep in check if I'm uncertain. And maybe if it's a little outside of my, therapeutic intervention, let's say, because I do feel I'd be doing a disservice if they didn't hear it or have it planted somewhere, and then they can go explore it somewhere else or have it.
Yeah, I like that idea a lot, because I think that what happens is if we're not sure, sometimes we feel like we're not sure how it's going to sit or land with the client, and better to bring it up as a possibility. With your permission, can we talk this through as an idea, as a perspective? I think that so much, even with all of our training and infertility, I think there's a lot of creativity that comes into play as a therapist, and I
Yeah.
think
And even from a
helping
medical
for
perspective, right?
sure, for
They may
sure.
not like, hey, did your doctor suggest this or this? Or like just putting those things out there. We have to be able to do that, you
Yeah,
know.
and that's interesting, because I wasn't even thinking about it from medical. I was thinking more about it from the therapeutic supportive
Mhm.
space. But you are right, and I've gotten pushback on that. Like that, do I have the right as a therapist to suggest, hey, can you talk to your doctor? Did you consider asking your doctor this question? And if you'll notice how I'm asking that, I'm not saying your doctor really needs to be doing this exam, this test, or this process, right? What I'm saying to them is, I want to offer you something that maybe you'd be considering bringing up in conversation with your doctor, and just to see what the doctor says. And I think that that also helps our clients feel a bit more empowered, right? A bit more like, oh, our therapist has something that she's knowledgeable about the medical. Now, again, like I said, pushback granted a lot of like, what right do you have? And I think that part of working in this sphere, in this space, requires you to be curious about the medical, because there are inconsistencies with how people are treated, and there's just differences of opinion. In addition to that, our clients can then say, this is what works for me, and this does not work for me medically. Like, I have a great, wonderful, amazing doctor. And then my doctor explained to me why they didn't authorize or request that test, which
Right,
is a valuable conversation
right.
between patient and client. Absolutely. When it
And
comes, yeah, go ahead.
I think one more piece in that realm, and this can get very, like, our therapist edition. So heads up, you have to have a really great long-term relationship with this client, in the realm of infertility, of exploring their infertility options. I
Yes.
spoke with one of my clients that she's going to write a book, 101 Ways to Get a Baby, because she's open to 101 ways to get a baby. And we as therapists have to be very careful. What are the client's ideas? Where they would go to? How far halakhically within those realms? Okay, because we're starting out with Clomid when they come in, and then there's the IUI, and then there's, well, I won't do more than this many IUIs, and then there's IVF, and then there's donation, and then there's adoption, and then there's right, surrogacy. And so for us to, again, with a really good relationship, understanding, and knowing where clients would go to, so that we have that, so that we can have those open discussions where a client may be never ever, and they would just like be so horrified. So we have to like delicately understand where do they see, things, or again, it's after a while and after they've maybe been in it for a while, just to understand
Like, how
that.
far are you willing to go? Right. I think one of the things that I know though about that process is very often what they came in saying this would be this is like the line.
Yeah.
That line moves pretty quickly.
Yes.
And
Yeah.
people will continue to, kind of expand what they could tolerate because what they thought they could tolerate is not what that's not where they're prepared to end the story. I'll share with you, I have a client who said to me, once upon a time client who said to me, before she came into therapy, the conversation was, I need to know whether you're going to force me into acceptance versus maintaining my level of hope. And this was, from the referral said, you just need to be very clear. Her major issues with previous therapists was they were trying to force her to accept the fact that she could not have children. And that was that was an easy one for me because I was like, yeah, that's not my job. And we also began to explore what it means to be hopeful as well as practical, hopeful as well as living the life that I've been given, always maintaining a thread of hope and totally living in the reality of what's medically available versus miracle available. And I think that learning that's some of the language I think we need to learn about how do we, like, it's so interesting because I never use the word acceptance. It's just not a language. I don't like that letter. I don't like that term. Because I feel like some people say what I've heard consistently is I can never accept that I cannot have a child, or I will never accept that I had that I had a baby that died, right? Like that, those acceptance feels almost like a surrender to it. And it's so interesting to navigate working with people without using the word acceptance or redefining the word acceptance. How do you use it in your
So I
conversations?
rarely use it in the conversation. And if it is, it's acceptance of just like today's reality. So it wouldn't be ever, and because no one would, I'm not going to accept that I'm never going to have a baby, or that this might be, I have to do it this way. But it's more in the what's going on for you right now, and can we be okay with it now? Right? Can we be okay with what's going on now and find hope in what could be, right? Again, within the medical, right? Because it's just we're limited. So we're not going to put out there like, oh, you need to accept that. Like, it doesn't feel good. No one's going to feel good about that. But I don't want to. Right? That's usually like, I don't really want to do that. I'm like, yep. No, why would you? And so I think there's this space of like more of being okay with what's going on right now for you. Right. And then that's the work of putting down some of these like just really, really sometimes blocking them emotions from just one foot in front of the other.
And I would like to suggest redefining what the word okay means,
Yeah.
right? The way they imagined okay, I am okay for today, or with what today brings, what they imagined okay looking like and feeling like could be incredibly different when working in this world of struggling to have a baby. And for today, in this moment, I can't, or I'm not, or this test results were pretty lousy.
Right.
Yeah.
And that,
Let's move.
and
Yeah,
that really just very much ebbs and flows, right? Because
sure.
many times, the client, okay, I'm waiting for the test results. I'm like, okay, see what's going to happen next week, right? And so that what was going to be or what wasn't is just so we have to kind of be ready to have that space for them to not be okay for
Right.
this minute, right?
Right. I think there's a lot of unknowns and a lot of waiting, right? Like infertility, I think, is really a practice of waiting and time passing and time not passing fast enough. And in many ways, time passing too quickly. Like, how did we end up here? We're 6 months out and nothing's changed. We have a little bit more information, but not actually anything closer to having a baby.
Yeah.
I think time takes on a totally, totally different meaning.
It's
Yeah.
so interesting because in some of our work, time is very healing, but in infertility, really it's this drag, and not just my month to month, and my 30 day, and my 28 day, and my next week, and when this cycle, and we're starting the cycle in, and how many, right? But also in what's going on around them. So not just are they paying attention to them, I have many clients that know every person's getting married and how many months later, and then how many months later the second one, and then so time is so still
Yeah.
here and waiting, and around me just going and going, and my close friends and her sister just got pregnant, and my right, like all of those things, time is just passing by for everyone else,
Yeah.
especially when you come into maybe like Entin or Rosh Hashanah and
All
you're
the
just
holidays. Right.
right,
Right.
right,
Right.
right.
Absolutely. I think it's probably the ultimate holiday. There's many holidays that people really, really dread when it comes to not having children or not having the family they hope to have. I think the New Year holiday, the Rosh Hashanah holiday, is really one of those holidays that in particular highlights where was I a year ago and how is it possible that I'm here? And how am I possible that I'm here again without the baby, the child, the family that I thought that I would be having, or at least maybe not even feeling that much closer to
Yeah,
creating that family. Yeah, it's a
yeah.
very difficult time of the year.
I'm
But you're
having a
right,
lot
the
of them.
highlighting of like calculating everybody else's dates and times. It's really amazing how much memory people can hold of like, and she got married at this date and this month, and then she had a baby, and now her kids are going to be even. She's going to have two kids before I'm even going to have one kid. It's a lot of attention, definitely a lot of attention to details.
Yeah.
Could we move into, you talked about the husband from the perspective of him being a supporter, but like kind of like a almost like on his own track and his own separate experience. I think the one thing I want to bring up about the husband, which I find always so complex, is when we are dealing with male factor, right?
Mm.
So I think we have to just say that male factor infertility holds its own
Yes.
completely its own identity. I'm not even sure we should kind of go into it at this point, but
We
male
need an
factor
episode
infertility,
on that.
yeah, it does need its own episode. That's for sure. And
Yeah.
because I think that it impacts not only the self, it impacts the couple, it impacts the way they see the world. Some do a better job of it than others, as with women, but it does hold its own kind of conversation. When we're thinking about the man and his relationship with infertility, when it is either unknown factor or female factor infertility, is there anything else that you notice about him and how he's dealing with, coping with these experiences individually before we jump into the couple?
Yeah. Yeah. So I think, interestingly, when it's male factor, he's carrying the same ideas as a woman with infertility. It's that something's broken, something's wrong with me. I can't give her, and for sure for the male, right, especially within our culture and halachically takes on, the mitzvah of appropriate, peruvu, and so there's this pressure, right? A lot more pressure. I think it's pressure on both. Again, they're not so different, right? There's
Right.
differences just in male and female how people are relating to it, but some of the themes are very similar. Something's wrong with me. Why can't I do this right? Male factor. I mean, we're really, really hoping and praying all these miraculous scientific things that are coming out from everywhere, just like happening like every day. I'm like, please, that would be like right.
Yeah.
But I think the husbands, the really needing support as well, and hopefully, right, getting it with the therapist, so that they can still navigate, all that's going on with them
Right.
and their relationship, right, just
Right.
as a couple.
I think these men also very much are very attending to their wives. Like, I just need to make sure my wife is okay. They're very attentive, but very often I think subverting their own experience. And I think some of this is a stereotypically differences between men and women. Women are emotive, men tend to not be as emotive. And so their ways of seeking support also will look and feel different. And even though study after study has shown the value of support for men, we really still have a very hard time getting them into
Yeah.
therapy and into support groups. But
Yeah. So they're playing
yeah,
basketball, they're going out,
or they're drinking, or
yeah,
they're smoking pot, right? Like, we have to acknowledge that some have pretty lousy coping strategies.
both.
Um, at both, exactly. I like them more playing basketball than smoking pot, but yeah, some and some. Let's talk about the couple. What are you seeing in the risk or of the dynamic between the couple when there is a diagnosis of fertility
What's
struggles?
interesting, I think, my lens in couples work is 25 years in couples work, EFT and training and certification. And so at this point, seeing couples with infertility, I can pretty much, not like I'm a guru or anything, but I can pretty much sense very quickly when the couple comes in how solid their foundation is.
Yeah.
And so, and that could be a factor of years, but not necessarily, just many different factors play into that, their background, what they saw, and how they started out. And so I think when I have a solid foundation, sometimes I'll have, I had a client who was worried about her relationship. She's like, you hear that these things can ruin relationships. And I had to like work with her to see, I think you guys have a solid one, right? Like she didn't recognize that. And like once she kind of, oh yeah, we do, right? It was a real worry of her because she had heard, and you hear this many times when couples are struggling with anything, there's a risk of, right? A risk of like what's going to happen with the couple if they can't. And so I assess pretty quickly how strong is this foundation, right? And then from there, it's like the work. So then that work is sometimes it's not even about the infertility. I just have to worry about their foundation, how they're going to support each other, how they're going to be there, how they communicate with each other, right? And
Right.
so that may be some piece, again, our therapist edition, don't miss that. Don't just throw yourself into the work of like infertility and what's going on, because the foundation of their relationship won't last if they're overly focused and not focused on each other. I had a couple one time that was just came in like, how are we going to support each other through this? I'm like, great, right? Like then
Mm-hmm.
that's not really about the infertility so much, but about how can we be there for each other more? How do we create, and then we talk about just creating a relationship of two when again our culture and well, it's always more and can I just be alone with my husband and what does that look like? So it's kind of assessing pretty quickly the foundation and then seeing, which I guess road the work needs to go to. Is it solidifying their foundation or is it supporting them and supporting each other in infertility?
I think, in addition to that, I remember once having a client who was so focused. I just need to have a baby. I need to have a baby. I need to have a baby. It was secondary infertility. And she finally had the baby. And this whole time, like the relationship is declining and declining and declining. And they're arguing and they're fighting. And eventually she gave birth and he was already sleeping on the couch. Like it was really had reached such a critical point of despair and ultimately of needing significant repair work that needed to come back into the relationship. And I think that can also happen, that like the focus becomes, like you said, on fertility and on the medical and on the get us to the next appointment and let's get pregnant, that sometimes especially when there hasn't been enough time for them to solidify the relationship or the marriage or in the communication, or they don't come from a healthy background, right? They don't know what it looks like to have a good, healthy, solid relationship and marriage. They don't have the tools to be able to navigate something really difficult and really tough. And so really always being mindful when working with a couple is how is that relationship doing? And how are we making sure that the couple is strong enough to tolerate and maybe even thrive in a really, really tough space? So, what are some practical tips that you would offer a couple when you're dealing with a couple that has known fertility struggles, beyond just working with them through fertility issues? What are some of the recommendations or suggestions you have to help them thrive as a couple?
Great. So some of these are just very basic that couples like need to be reminded of. So I think the communication piece, like we know in all couples work, is super critical even more so, right? So being able to, and it's always this common theme, why do you think he's going to know what you need? Like, what is that? What is that in our entire
I
society?
don't know.
I'll take a pen and I'll just go like, Pop, I'm so sorry to pop that bubble. He doesn't know anything you need. She doesn't know anything you need unless I communicate it. And it's okay. And the
Right.
more we're able to communicate, I need my space, I need my time, I need my distance, I need you on board, I need you not on board. It's like, oh, okay, if I just tell that person what I need, it makes it, oh, of course I want to, right? Of course I want to do this for you if I can. So I think there's the communication piece is just time and time again. It's like at nausea, but it's so critical. Um, and then the piece is like, the individual and the couple, helping the couple, right? So it's not just like, oh, vacation's going to be nice, but making time and space and special things for each other are going to be important, as well as each of them having their individual, right? Because a couple could end up spending a lot of time together,
Yes.
especially COVID couples. Like
Yeah. That was rough.
that was rough. We had like a lot of support around that. And then what are you doing outside? Your friends, your family, your work, your hobbies. So, and honoring that space that for him, what might be whatever is for her something else,
Yeah.
and that they can give each other that. Another piece is that for each couple, not to put on each other what's going on with them so much. And I can do this a lot in the individual work. Let's say a female comes in and husband doesn't want to, like, you don't always have to be on the same page exactly. Like,
Right.
well, I'm up to IVF and he's not ready for it. We have to do this. I need him too. And I'm like, whoa, right? You don't need him. Obviously, you need consent and from the medical and your guy, they need him. But it's okay at this point and to honor space for each other if one takes a little slower, one's not up to that yet, one needs a little bit more knowledge and information, one wants to go consult one other person before. So I think that's a big space. And then another thing is, like, I guess you could say just like in the events round, and when you're going to something, when you have to show up for something, how can they be supportive of each other? Can they, and I always say preparation is the best. If you prepare for anything, it could be a disaster still, but at least you prepared, right? So even in the medical aspects, I'll do a lot of prep before retrievals and transfers. What's it going to look like? What's it going to feel like? Who's going to be there after, before, in the emotional support? So the same thing with going to a birth,
Right.
right? How are we going to go? Do we have to go? Do we want to go? What am I going to do? Can we have like a code word, like quick, we're out of here?
Right.
And a lot of permission around, like, there's no rules here. Guess what, guys? You get to do what you each individually want. And sometimes each individually wanting something, you know what? It's important to be at that. I'm going to show up, say hello to the family, and then I'm going to go, but you stay. It's okay. And
Right.
then really hearing that that's okay also. You don't have to be on this like, I want to go and she wants to stay. I want to go. Okay, so can you go and she's staying? You guys be okay with that?
Right. For
So
sure.
that's some of the
I think about it also like just from like a broader framework of how critical it is to nourish and nurture the relationship. That you have to put time, attention, energy into that relationship. We every single couples training talks about date night, right? And maybe it won't be a date night. It may need to be a date 15 minutes. It may need to be just showing up with each other and having a conversation about something other than infertility. It might be a temperature check. How are you feeling? How am I feeling? I recently had somebody who her husband they were around somebody who had just had a baby and everybody was talking about the baby and they don't have children. And he looked at her and he said, this was actually really hard. And for the very rare moment where he expressed a vulnerability, she was so happy that he was vulnerable with her. Like that moment of checking in and saying, I'm also having a hard time helps a couple feel connected and rooted in each other. And that if that happens and when that happens, the long-term implication of the difficulty is going to be minimized. And so I think the protective factor to managing and navigating infertility really is about creating, like you said, solid communication, solid connections, and a solid relationship that no matter what comes next, the marriage will be better. The relationship will be better. They are stronger because of it. And I think that sometimes gives couples this sense of like, well, that I can do, right? I don't have much control over having the baby. I don't have much control over whether I'm going to ovulate or not, but I do have some control over what kind of marriage I can create with my spouse. So just that really supported um, communication between husband and wife.
And
I'm
you'll hear
wondering,
that,
yeah,
like it's such a sweet line that
yeah,
I've heard several. And it's very heartwarming when you'll hear one of the couples say, like, it's okay, we're good. If we never have a baby, we're so good.
we're
Like
good.
we're gonna
Yeah,
just be like
we're
it's
gonna be
us.
okay. Yeah,
Yeah. And it's
yeah.
just, you know,
Yeah, agreed. Let's just real quick before we finish our conversation today, Chanie, tell me about one or let's say two misconceptions that you would like the world to know is just a misconception. Two things you want them to know.
um, I don't think we're ever going to get it exactly right. I think from both ends, right? I think from a couple or an individual experiencing infertility, no one's going to get it right, like exactly how you want it. And then from a therapist saying it or a support, they're not going to get it right either. And like, I
Mm,
think everyone's going to be okay, right? I think it becomes this, I think it's causing a lot more pain and damage than needs to. And so if we're all like, it's okay if no one gets it exactly right.
mm.
That will just like lessen some of the, I mean, some people say really stupid things.
Yes. I
We have
heard
a
some just, I have
we
to
have a
share
book
this with
for
you.
that. All
We
the
have a book
stupid
for
things
that.
people say.
Yes. I just have to share with you at a training recently. I heard a woman say this line. She said, I tell my clients to have a mean well jar. Like they mean well. And that was the line they said. And just put it in the mean well jar. So she's like, it's like an imaginary thing you could put in or an actual jar that you put money or candy or a marble in. This is my mean well jar because they meant well. But you will, I love that. It was such
Love
a
that.
clever
I'm
way of
using
saying,
that therapist
absolutely.
edition,
I'm sharing
right?
it for people to use, right? Because it was just so clever, that idea of like, yes, they meant well, but they also hurt you. And can I be a little bit forgiving of the person, even though I don't have to be? Can I be, like you said, we would be a whole lot better off if there would be more forgiveness on either side. Any other misconception that you want people to think about?
I think there's like this idea of like everything's so definitive. And I think in the work that we can provide and give to our clients and to each other is that it's so fluid. Like life is, infertility is, science is, God is. Like we just
Mm,
don't know where things are going to be. And I think, for myself as a therapist, when I'm always like it's humbling to me as opposed to, oh, they're going to have to do, like if I start jumping ahead, oh, they're already at this or that, or they're going to have to go down this. You have to like rein yourself in, Chanie. You don't know where things are going to go. And when I can take that step back, I role model it for the clients, right? Just slowing things down. And for myself as well, like just, and for them, like this journey, okay, just right now, right? Because it can be daunting and overwhelming. And yes, you want to, that's where that control factor comes in. Well, or this person or that story, or it's going to be. And so when we can just slow everything a little bit down and know that like nothing's like so concrete this minute.
I love it.
It's
Beautiful.
helpful.
Thank you. Honey, thank you so much. Thank you, thank you, thank you for being willing to have this conversation and for sharing your wisdom with other therapists. I know we all learned something today, so thank you.
Thank you for having me. Thank you for putting out all this content. It's amazing.
Thank you.